So about healthcare, you said that was your number 2 big focus of this campaign. What is wrong in your view with our healthcare system? How do you fix it?
Well, what's wrong is not everybody is able to have access to health care. And the problem is when somebody gets sick, your body doesn't care if you have health care or not, you get sick. And so they have to make the worst decision they probably ever had to make. They either show up to the hospital and bankrupt themselves, or they bankrupt the hospital because they're not able to pay those bills. I think that we are now at a day and age where we do need to expand Medicaid responsibly in a way that helps us make sure folks have coverage.
And you're talking about expanding Medicaid to Georgia instead of what is currently in place, Governor Brian Kemp's Pathways program, right?
Yeah, and I think part of that is effective, but the numbers of the Georgia Pathways program are not, they're not strong enough, right? There's only 6,000 people. There may be some more in the past few months that have added on, but not enough of the eligible 300,000. So if able-bodied folks are able to work, certainly we want them to work, but there's so many different unique scenarios that pop up. I mean, there's folks that are having to take care of aging parents, there's folks that are having child care situations, there's folks that have behavioral health issues. There's a lot of asterisk marks around healthcare, and so we need to make sure that we show up in support of as many folks getting health care as possible, because how can you get a job if you don't have health care? How can you carry on and be a participating member of the community if you're sick and can't get treatment?
You were Lieutenant Governor from 2019 to 2023. When the Pathways program was being rolled out, did you support it at that time?
I did. I thought it was a step in the right direction, but never would have thought the results would have been as dismal as they are.
Isn't that a little bit the job of a state lawmaker, to foresee those challenges?
Yeah, absolutely. I think that what we've seen play out, and this is one of the issues with healthcare, is there's so much clerical. I think the feedback we're getting is folks are having to go through so many hoops to just verify that they are working, that they are receiving educational activities, that they are volunteering. The administrative hurdles are so large that I think that's a really big part of the problem.